Sterilization means that a. All organisms have been removed from an object. B. All pathogenic organisms have been removed from an object. C. Debris has been removed from an object with soap and water. D. The object has been placed in boiling water. E. The object has been subjected to ultrasonic cleaning. Answer A. All organisms have been removed from an object. Using a tape measure to evaluate the head and chest circumference of an infant is called A. Auscultation. B. Mensuration. C. Palpation. D. Percussion. E. Observation. Answer B. Mensuration. What is the maximum time allotted for a collected blood sample to sit in a serum separator tube before being centrifuged? A. 1 minute. B. 5 minutes. C. 15 minutes. D. 30 minutes. E. 60 minutes. Answer D. 30 minutes. A medical assistant is giving a DPT injection to a 6-month-old infant. The assistant would give the injection at which of the following sites? A. Upper outer quadrant of the gluteus muscle. B. Deltoid muscle. C. Vastus lateralis. D. Subcutaneous tissue of the thigh. E. Gluteus medius. Answer C. Vastus lateralis. Which of the following actions should the medical assistant take to ensure disposable thermometers are ready for an exam? A. Confirm that they have been autoclaved within 28 days. B. Ensure the expiration dates have not passed. C. Swab the tips with alcohol. D. Place probe covers on them. E. Store them in a locked cabinet. Answer B. Ensure the expiration dates have not passed. What information will not be found in the medical record of a patient? A. If the patient admits to any illegal drug use. B. Personal opinion of the medical staff. C. Legal history of the patient. D. Direct quotations from the patient. E. Medication history. Answer B. Personal opinion of the medical staff. If the physician is going to do a pap smear, the medical assistant should have which the following equipment available? A. Curette and dilator. B. Speculum and water-soluble lubricant. C. Suture removal tray. D. Hemocolt card. E. Sterile gloves and a light source. Answer B. Speculum and water-soluble lubricant. Emergency treatment for a second-degree burn would include A. Bandaging tightly. B. Breaking any blisters seen. C. Applying a clean, cool, wet cloth to the area. D. Scrubbing the site with antiseptic soap. E. Applying an emollient cream. Answer C. Applying a clean, cool, wet cloth to the area. Evaluation of the spinal column is accomplished easily from which of the following positions? A. Knee chest. B. Prone. C. Supine. D. Lithotomy. E. Trendelenburg. Answer B. Prone. To respect the patient's privacy while obtaining information about their history, you should A. Ask the patient to fill out a form rather than asking the questions in an interview. B. Ask the patient to specify people who can give information about them. C. Take the patient to a quiet and private area to obtain the history. D. Let the doctor ask any questions that you feel the patient may be sensitive about. E. Explain that if the patient does not want to answer any of the questions, it is not required. Answer C. Take the patient to a quiet and private area to obtain the history. Which of the following terms is defined as the concentration at which a substance in the blood, not normally excreted by the kidney, begins to appear in the urine? A. Supernatant. B. Refractive index. C. Renal threshold. D. Micturition. E. Aliquot. Answer C. Renal threshold. The patient is having occult blood in the stool caused by a medication that they are taking. Which of the following medications would you suspect? A. Lisinopril. B. Coumadin. C. Prozac. D. Hydrochlorothiazide. E. Ativan. Answer B. Coumadin. A fomite is A. An animal or insect that can transmit disease. B. A method of removing pathogens used on objects. C. An inanimate object that can harbor pathogens. D. A sexually transmitted disease. E. A method of sanitization used on objects that cannot be scrubbed. Answer C. An inanimate object that can harbor pathogens. To correctly treat an adult with a foreign body airway obstruction, the medical assistant should first A. Open the patient's mouth and attempt to remove any foreign body that can be seen. B. Lower the victim to the floor and start to perform abdominal thrusts. C. With the left hand, check the pulse at the left carotid artery. D. Ask the patient, "Can you speak?" E. Place your hands around the victim from behind, palms against abdomen, and thrust upward. Answer D. Ask the patient, "Can you speak?" The Ishihara test is used to diagnose A. Myopia. B. Hyperopia. C. Presbyopia. D. Color blindness. E. Need for reading glasses. Answer D. Color blindness. A non-sterile item is accidentally added to a sterile field being prepared for the suture of a skin laceration. Once the medical assistant discovers this, they should A. Report it to the physician. B. Remove it at once. C. Leave it on the sterile field but cover it with a sterile towel. D. Replace the item with a similar sterile one. E. Redo the sterile field and re-sterilize any instruments. Answer E. Redo the sterile field and re-sterilize any instruments. The process used to wash and remove tissue from medical instruments is called A. Asepsis. B. Disinfection. C. Sanitization. D. Sterilization. E. Boiling. Answer C. Sanitization. Which of the following is the maximum amount of time a tourniquet should remain on the patient's arm during the performance of a routine venipuncture? A. 30 seconds. B. 60 seconds. C. 2 minutes. D. 3 minutes. E. 5 minutes. Answer B. 60 seconds. In a large-scale national disaster or disease outbreak, which of the following considerations should be taken into account by a medical practice office? A. Some patients will come to the office for care due to overcrowded emergency rooms. B. The practice may need to administer vaccinations or immunizations to their patients. C. The practice should communicate with local public health officials and participate in a coordinated plan. D. All of the above. E. None of the above. Answer D. All of the above. Employment, use of tobacco and alcohol, and exercise habits are listed in which of the following sections of the patient's chart? A. Social history. B. Chief complaint. C. Review of systems. D. Medical history. E. Family history. Answer A. Social history. If your patient is being treated for a severe upper respiratory infection, which of the following medications would you not expect to see ordered? A. Amoxicillin. B. Albuterol. C. Robitussin. D. Hydrochlorothiazide. E. Cipro. Answer D. Hydrochlorothiazide. The microscope condenser is responsible for A. Collecting and concentrating light rays. B. Holding and moving the slide. C. Controlling the amount of light focused on an object. D. Coarse and fine adjustment for object focus. E. Evaporating water from the slide. Answer A. Collecting and concentrating light rays. You should suspect that a patient may be having a heart attack if the patient is complaining of A. Blurred or double vision. B. Severe headache. C. Pain in the shoulder or jaw. D. Difficulty understanding spoken words. E. Weakness on one side of the body. Answer: C. Pain in the shoulder or jaw. When drawing multiple tubes of blood via venipuncture, what is the correct order of draw based on colored stoppers? A. Lavender, red, green, yellow. B. Red, yellow, lavender, green. C. Green, yellow, lavender, red. D. Gray, yellow, red, blue. E. Yellow, red, lavender, green. Answer: E. Yellow, red, lavender, green. Which of the following is a CLIA-waived, low-complexity test? A. Microscopic examination of urine. B. Gram stain. C. Blood chemistry. D. Pregnancy test. E. Pap smear. Answer: D. Pregnancy test. Normal respiratory rate for an adult is A. 8 to 12 breaths per minute. B. 8 to 16 breaths per minute. C. 12 to 20 breaths per minute. D. 12 to 26 breaths per minute. E. 20 to 26 breaths per minute. Answer: C. 12 to 20 breaths per minute. After drying and removing packs from the autoclave, the first thing that you should do is A. Place the newly sterilized packs under the older ones in the storage area. B. Discard all outdated packs. C. Check the indicators to confirm they have changed color. D. Mark packs with your initials and the date sterilized. E. Seal in a plastic bag to ensure sterility. Answer: C. Check the indicators to confirm they have changed color. Which of the following medications would not be ordered for an elderly patient with cardiovascular disease? A. Lanoxin. B. Lasix. C. Potassium chloride. D. Lisinopril. E. Prozac. Answer: E. Prozac. To be prepared for an office emergency, the medical assistant should A. Keep policies for emergencies nearby for reference. B. Ask a more experienced person in the office to handle any emergency. C. Review the office policies and be aware of location of emergency supplies. D. Call 911 immediately. E. Make a list of emergency phone numbers to place close to the telephone. Answer: C. Review the office policies and be aware of location of emergency supplies. Examples of a bandage include A. Steri-strips. B. Telfa. C. Tubular gauze. D. 4x4 gauze. E. Clear foresight. Answer: C. Tubular gauze. Which one of the following tests is used to determine the best antibiotic to treat a condition? A. Blood agar. B. Culturing. C. Morphology. D. Liquid culture medium. E. Sensitivity. Answer: E. Sensitivity. A blind weight is done on a patient by A. Not recording the weight in the patient's chart. B. Asking the patient to self-weigh at home and report it when at the office. C. Weighing the patient in the wheelchair and then subtracting the weight of the chair. D. Shielding the readout so the patient is not aware of what the reading is. E. Taking the weight at the appointment. Answer: D. Shielding the readout so the patient is not aware of what the reading is. An effective way to handle patient emergencies in a medical practice office is to take which of the following steps in advance? A. Ask very sick patients to go to the hospital emergency room. B. Identify the at-risk situations that are most likely to occur, given the patient population seen in the office, and prepare to provide care for these situations. C. Make sure that a doctor is consistently available. D. Have a first aid kit in the office. E. Post the phone number for poison control. Answer: B. Identify the at-risk situations that are most likely to occur, given the patient population seen in the office, and prepare to provide care for these situations. In the event of a large-scale act of bioterrorism, Which of the following steps would not be an approach to be used by a medical office practice? A. Coordination and communication with local public health officials. B. Providing vaccines and/or immunizations. C. Knowing the signs and symptoms related to a disease outbreak. D. Sending patients to the emergency room for diagnosis. E. Practicing proper infection control and waste disposal of contaminated material. Answer: D. Sending patients to the emergency room for diagnosis. Snellen testing results give information about A. Blood sugar results. B. Visual acuity. C. Ability to hear vibratory sound. D. Blood pressure. E. Colorblindness. Answer: B. Visual acuity. Which of the following emergency situations should receive the first priority? A. Bleeding from a laceration of the forearm. B. Occluded airway. C. Open fracture of the femur. D. Midsternal chest pain. E. Grand mal seizure. Answer: B. Occluded airway. The medical assistant's role in obtaining informed consent is A. Explaining the benefits and risks of the procedure. B. Making sure that the patient understands and has no questions. C. Answering all questions that the patient has about the procedure. D. Witnessing the signature of the patient. E. Explaining alternative treatments to the patient. Answer: B. Making sure that the patient understands and has no questions. To remove sutures, the medical assistant should have a tray with instruments that should include A. Kelly hemostat. B. Mayo scissors. C. Sen retractor. D. Littauer scissors. E. Bandage scissors. Answer: D. Littauer scissors. When there is an unidentified clear liquid on the floor of the exam room after a patient has left the room, the medical assistant should A. Go and ask the patient if they are aware of what the liquid is. B. Clean up the spill with a disposable paper towel and place in the regular trash container. C. Put up a wet floor sign and ask a housekeeper to clean up the area. D. Put on exam gloves, clean up with a paper towel, and put it in the biohazard container. E. Put on sterile gloves, clean up the spill with a paper towel, and put it in the biohazard container. Answer: D. Put on exam gloves, clean up with a paper towel, and put it in the biohazard container. A viral infection. A. Cannot be transmitted by droplets. B. Will always resolve in 7 to 10 days. C. Does not respond to antibiotic treatment. D. Causes tuberculosis. E. Can always be prevented by vaccination. Answer: C. Does not respond to antibiotic treatment. Factors that affect the action of drugs include all except A. Body weight. B. Use of generic medication. C. Sex. D. Age. E. Disease processes. Answer: B. Use of generic medication. When checking supplies in the office, the medical assistant notices that the hemostats in the cupboard were autoclaved 28 days ago. The medical assistant would A. Confirm that each package is intact and without damage. B. Count to see if there are enough available for the amount of expected procedures. C. Place the packages back in the autoclave and run the appropriate cycle to re-sterilize. D. Unwrap and repackage items and run through the appropriate autoclave cycle to sterilize. E. Redate the packages for an additional 28 days. Answer: D. Unwrap and repackage items and run through the appropriate autoclave cycle to sterilize. Symptoms of insulin shock include A. Fruity or acetone smell to the breath and a decreased blood sugar reading. B. Tremulousness and an elevated blood sugar reading. C. Diaphoresis and a fruity smell to the breath with an increased blood sugar reading. D. Confusion, tachycardia, and an elevated blood sugar reading. E. Diaphoresis, tremulousness, confusion, and decreased blood sugar reading. Answer E. Diaphoresis, tremulousness, confusion, and decreased blood sugar reading. Which of the following steps helps ensure smooth operation in the medical office during a patient emergency? A. Adhering to a pre-established plan and protocols for managing the emergency. B. Avoiding setting up appointments for seriously ill patients. C. Arranging for close proximity to the local emergency room. D. Clearing the office out during a patient emergency. E. Having an AED device on hand. Answer A. Adhering to a pre-established plan and protocols for managing the emergency. Prior to administration of a local anesthesia, the medical assistant should A. Administer a test dose to make sure the patient does not have an allergic reaction. B. Ask the patient what local anesthesia they have had in the past and use the same medication. C. Carefully take an allergy history from the patient prior to the procedure. D. Confirm that the patient has brought someone along to drive them home after the procedure. E. Look in the patient's chart to see if the patient has had a minor surgery procedure done prior. Answer C. Carefully take an allergy history from the patient prior to the procedure. The knee-chest position is used for A. Proctological exams. B. Vaginal exams. C. Exam of the chest and upper torso. D. Patients who have difficulty breathing. E. For treatment of hypotension. Answer A. Proctological exams. Which of the following positions should the patient be in for a vaginal exam? A. Prone. B. Lithotomy. C. Simsas. D. Fowlers. E. Semi-Fowlers. Answer B. Lithotomy. The first thing a medical assistant should do when coming across an adult who is not responsive is A. Give 2 rescue breaths and then start chest compressions. B. Roll the person onto the left side, keeping the neck and body in alignment. C. Check for a carotid pulse on the side closest to the assistant. D. Look into the mouth to see if there is an object obstructing the airway. E. Reposition the airway and check again for spontaneous respirations. Answer C. Check for a carotid pulse on the side closest to the assistant. When checking the sterile supplies in the office, the medical assistant should A. Unwrap and re-sterilize any sterile packs that are older than 21 days. B. Examine sterile packs and discard any that are damaged. C. Arrange sterile packs so that the ones that will expire last are used first. D. Seal sterile packs that are expired in plastic in order to extend the time they may be used. E. Discard sterile packs that have been taken into patient rooms but not used. Answer B. Examine sterile packs and discard any that are damaged. Sterile technique must be used when A. Placing sutures in a new laceration. B. Removing sutures from a healed laceration. C. Performing a pap smear. D. Performing a rectal exam in order to do a hemocult. E. Cleaning the skin prior to placement of sutures. Answer A. Placing sutures in a new laceration.